This is Newsmaker Sunday.
Good morning. Welcome to Newsmaker Sunday. I'm Tom Zalaski. April is Sexual Assault Awareness Month, and an organization in Northeast Wisconsin is helping to bring that issue to the forefront. And joining us this morning is the CEO and Executive Director of Reach Counseling, Kristen Trimberger, along with Noelle Fenwick, the Associate Director. Ladies, thanks so much for being here with us this morning. Thank you for joining us. Let me first ask either one of you, Reach. What is Reach?
Yeah, Reach is a sexual assault service provider. We work with children and adults and their support systems. We provide prevention education, advocacy, counseling, sex offender treatment in Winnebago, Outagamie, and Calumet counties.
If you were to say an overall mission that you have, what would that be?
Really, our overall mission and vision is to end sexual violence in the communities that we're serving.
You know, there are organizations here in Green Bay. We've got Golden House, there's Harbor House, there's Pillars. How are you different, or are you just an extension of those services?
Yeah, well, I think we are all anti-violence agencies, so we do partner in a lot of ways. One thing that really sets Reach apart is our counseling program. So we are a licensed clinical medical clinic that works with survivors to provide licensed therapy treatment for people as they're healing.
We mentioned the organizations up here in Green Bay and down in Appleton. How did Reach come into being? I mean, what was the trigger? What was behind it? Where was the need? What was the need?
Yeah, so I can actually snag that one if that's okay. So we were established in '76, and we started as just a small county response team that eventually snowballed over the years into who we are today. Something that I think is really cool as well is somewhere along the lines in our history, ourselves and Christine Domestic Abuse Services were one organization.
Really?
And we realized that, domestic violence and sexual assault, we've both had a lot on our plates. And so the domestic violence portion sectioned off and later turned into Christine Domestic Abuse Services. And then we sectioned off and later became Reach Counseling Services. And
that's going all the way back to '76 that you did. How did both of you get involved in the organization? Your backgrounds, what brought you there?
Yeah, so most of my career has been spent working with nonprofits. So I actually started with the Building for Kids Children's Museum in Appleton. And from there, I was the executive director at St. Vincent de Paul. And I also spent a small time at Goodwill NCW before ending up at Reach Counseling. And I have to say, I'm very, very passionate about Reach's mission. And I really feel like I've found my spot. The organization has really transformed over the last 2 years, and we have an amazing team. So I feel very fortunate to be there.
Yeah.
How did you get there?
So I am a UWO alum, UW Oshkosh, and in my junior year of college there, I was getting really passionate about sexual violence prevention and response and just trying to find a spot to channel it. And so I actually started as a volunteer. We have a volunteer program specifically full of volunteer advocates. So something that's really great about us, we offer 24-hour response to forensic exams. So day or night, holiday, whatever that may be, someone will be there to show up for a survivor and accompany them through that exam. So I did that as a volunteer until I graduated. Had some time as a victim advocate on staff, as a prevention educator, as a youth and teen advocate, and then later worked my way to where I am now, which I think I found my own niche in the organization doing grant writing and donor stewardship.
So you were a college kid and a volunteer. You probably saw and heard things that most people will never see and hear, and yet you still wanted to continue with that.
Yeah. It's like once you know, you can't look away. Once you know, it's everywhere. There's definitely, I think I view the community through a very unique lens because there are stories attached to certain bars or parks or memories that I have from survivors that I've worked with over the years. So it's definitely shifted my lens, but it motivates me to continue working on our mission.
How many people are you serving? Any idea? I mean, monthly, yearly, weekly?
So in 2022, we served right around 500 individuals, so 257 through our advocacy program and 297 through our counseling program. And that's just the individuals seeking services. That number doesn't include their support system, so like their siblings or parents or guardians or others that we might be providing some counseling sessions or advocacy for as well.
And where are these people coming from? Who's contacting you? What's the range in the state or in Northeast Wisconsin?
Yeah, I mean, it sounds a little cliche, but it really is everyone. Really? Sexual violence doesn't discriminate based on socioeconomic status or gender or age. So we see folks through our advocacy program who are very, very young. And we see folks who are also, in the way other end of the spectrum. We get introduced through local hospitals, through local law enforcement, through things like this, where folks hear about our services, especially when we talk about child survivors. When we get into the schools and give our prevention education programming, that's often the first time that a child's realizing that what happened to them is abuse. So really a wide spectrum on how folks come in to seek our services, and just a spectrum in terms of the different kinds of folks that we see.
And how do people contact you? How do they get a hold of your services, either in times of not necessarily a crisis, but just on any given day?
Yes. Oh, go ahead.
So we have our office line that also turns into a 24-hour hotline after our office is closed for the day. So it's one easy number to remember, and that's 920-722-8150.
Say it again.
920-722-8150.
Because someone out there will someday need it, I'm sure. Sexual assault awareness. We have some surprising statistics that will surprise you when we come back. Stay right there. Back now with Kristen Trimberger and Noelle Fenwick of Reach Counseling, talking about sexual assault awareness. I want to throw some figures out here that your office provided. More than 1 in 3 women, more than 1 in 4 men have experienced rape, physical violence, and stalking by an intimate partner in their lifetime. That's a lot of people. Are you seeing more and more cases involving this type of stuff?
That's a great question. So I will say yes, especially since the pandemic. We have seen a large increase in the demand for our services. During the pandemic, when people were staying at home, a lot of children didn't have access to a safe adult. So they were attending these classes on Zoom, but didn't have a lot of one-on-one time with like a guidance counselor or a teacher. And so once the kids started going back into school and our educators were out in the schools providing information to them, we had many, many children that started coming forward that had experienced sexual violence and abuse during the pandemic while they were doing safer at home.
And we heard so many stories during the pandemic that people who were victims of abuse were now finding themselves quarantined with their abuser.
Mm-hmm. Absolutely. And what's interesting about that time is you think about the increasing risk factors for abuse to take place, because you have people that are losing their jobs. They're worried financially. Addiction is kicking up because of the stress. People are at home, they're using drugs more, they're using alcohol more. It really led to this perfect storm where unfortunately a lot of victims, a lot of survivors were stuck at home with their abusers and their perpetrators.
Yeah, this was not just sexual abuse. This was all types of abuse. And it was over a 2-year period, essentially.
Yeah.
When a person is sexually assaulted, what is their first concern when they contact you? What do you tell the victim?
Yeah, that's a great question. I will say, there isn't one survivor that fits a certain mold. Yeah. So it can definitely really vary from person to person. Oftentimes, the very first thing that a survivor will go through is that sexual forensic exam at the hospital, especially if there's any worry about physical health or any injuries. That is always the first thing that we talk about if we have someone on the hotline who's recently experienced an assault, is explaining the benefits of that exam. And that every step is really, about the survivor and what they need. Doesn't mean they have to report to the police. It doesn't mean we have to collect evidence. you can go in and just make sure you're healthy, and that's fine too. But something that I think is really cool about the program is that if you do want evidence collection, they can hold that evidence for up to 10 years. So then you have that option years down the road. If you've maybe gone through counseling, you've healed, and then you'd like to seek justice, then that's an option that's available.
What kind of training do you go through? Because I know if I ever took a call like that, I'd be like, what do I do?
Yeah.
You know,
Yeah.
how do you learn to take these calls?
Yeah, it's definitely, we teach as much as we can about, crisis intervention, about these common symptoms that are coming up for survivors, things like self-blame and denial and anger and these feelings of desperation and this deep sadness. Again, folks can experience any of these emotions at any given time throughout, after an assault. But helping our volunteers understand that all of that's normal and it's okay, and communicating that then to the survivor so that they feel less alone. That's something that I think all advocates would agree, all of our volunteer advocates would agree, is no call looks the same. So every survivor has really unique needs, but just understanding that base level of what they're going through and letting them know that they're not alone.
And are there calls that come in that don't necessarily need immediate attention? Somebody just wants to say, hey, I might be in a situation and I may need some help?
Yeah, absolutely. We definitely get a wide array of calls. Not all crisis, and that's why even in some of our language we've dialed back calling it a crisis line and just a helpline, because you don't need to be in a level 10 crisis to seek our services.
We continue with Reach Counseling right after this, so please stay with us.